I recognize my co-sponsor and colleague, the representative from Connecticut, Mr. Courtney.
Thank you, Mr. Chairman. I move to strike the last word. And again, I want to thank you for, again, your really persistent, diligent leadership on this bill, and also for bringing the bill out early in the 119th Congress. This is at least our third push in terms of getting this bill passed, and we have actually gotten it passed through the House, but you know, obviously time gets to be the enemy sometimes in terms of getting the upper chamber to follow suit. So again, getting this bill moving quickly, I think, is really helpful and important. Again, I think you've explained the bill quite well. I mean, in its simplest terms, it's a straightforward bipartisan bill that will strike some of the barriers federal workers face seeking treatment and care after they're injured on the job. We hear from our districts about the real shortage of healthcare providers, and again, not just in rural areas, but even suburban and urban areas. And that's really, I think, the driving force why it's important that Congress surgically and intelligently reform outdated, antiquated policies in place that prevent qualified providers from treating patients who need their high-quality care. This bill achieves that goal for federal employees who need treatment for workplace injuries by allowing nurse practitioners and physician assistants to treat those patients and be reimbursed under the Federal Employees Compensation Act. Again, in 2025, it's just the reality of nurse practitioners and PAs is something that all of us experience, you know, in both primary care and even more specialized care. So it is really well past time for us to move forward on this legislation. And to foot stomp your point, it's not going to expand the scope of practice. Again, it's tailored so that nurse practitioners and physician assistants would continue to practice under the existing parameters of their state license. But what it will do is remove a prohibition from participation in FECA and align FECA's program for NPs and PAs in the way that they're treated today in other federal health programs, from the Veterans Administration to Medicare to the Indian Health and Service. Medicare first allowed nurse practitioners to bill the system directly in 1997. So I think, again, the roof didn't fall in, you know, when that change took place, and I think we should all have, you know, strong confidence that this bill is not going to, in any way, cause any harm to the system. In fact, it's the opposite in terms of allowing patients to access health care after an injury. Again, like you said, we have ample record in the committee from people from all across the country who had to, you know, travel out of state, you know, had delays in terms of, you know, critical appointments. I mean, we're talking about workers' compensation. We're talking about people accessing cash benefits, as well as getting evaluations and comp ratings. So, you know, this is, for a lot of people, time is the enemy and time is money. So it is really important to make sure that people get timely care, and that's exactly what this bill will achieve. It's endorsed by the American Association of Nurse Practitioners, the American Academy of Physician Assistants, as well as a diverse coalition of unions representing federal employees, such as the National Treasury Employees Union, National Postal Mail Handlers, and the American Federation of Government Employees. As I said, it's passed in the House with bipartisan support in prior years, and hopefully we'll move this bill quickly to achieve the same goal. Mr. Chairman, I'd like to submit a few letters of support for the record from AAPA, AANP, and the National Rural Health Association.
Without objection, they are received.
Great. And again, I want to just thank you again as lead sponsor of this bill for your support and bringing this issue forward today in a timely fashion. With that, I yield back.